It's something that I've thought about recording for a long time, but never sort of gotten around to it because it's kind of awkward to just sit and talk to your laptop and then upload it on the internet. But yeah, recently uploading sort of a GAMSAT prep video and a few messages from people that have been trying to get into med for a while, as well as a message from someone in med who was sort of wondering about what the repercussions of getting help are. So it just made me feel like it's something worth doing. And so here we are. My name's Sam. I'm about halfway through my medical degree in Adelaide, Australia. But that's not really why I'm recording this. I'm recording this more because of my journey before medical school, and sort of my own journey with mental health. Um, I recently got asked to speak sort of as a fill-in for the speaker that was meant to speak, who was unwell at this sort of student conference called GHC, to speak about mental health and mental health in medicine. And I figured kind of what I said there, I'll distill into a bit of a video here, um, just in case, one more person benefits from it. Because if so, then it's worth doing. Um, but the thing about the whole sort of medical sphere, starting from the GAMSAT process and the application process and the interview process, but then also being in medicine, is that the environment is really conducive to bad mental health, and part of that is because of the sort of person that medicine attracts. It's high achievers who are really ambitious, work really hard, have a lot of pressure on themselves, sometimes come from families that put a lot of pressure on them to succeed and sort of almost compete, and that's quite a big risk factor for feeling good and feeling happy and healthy and strong and okay. Um, But then, yeah, I guess the other aspect is that the environment of med and the process by its nature is also probably not very conducive to good mental health. You start with sitting a big test and for a lot of people getting rejected or sitting interviews and getting rejected and going through that rejection process. And then, eventually in medical school, there's a lot of content that comes very quickly, that you don't get much time to sort of absorb before moving on to the next thing. There's constant, assessments on the horizon and new placements and new topics and not a lot of time, I guess, to look after yourself and do the things you need to do to be well. And I think the combination of those two things plus a lot of other factors leads to a sort of an environment that's a catalyst for bad mental health, and bad mental health outcomes. I was relatively involved with the psychiatry society, like the psychiatry student society at our university, over the last 2 years, and we ran some stations on mental health first aid, mental health first aid, and sort of like OSCEs for psych and just well-being for students and stuff like that. And often after those sessions, people would reach out privately or come up to me afterwards, or come up to other people organizing it afterwards and just say, I have been struggling and didn't feel like help was something that was seeking help wasn't something that you did. You were sort of, we're here to become healthcare workers, not patients, and we're on the other side of it, and how can I be this big successful ambitious person if I'm also someone that's got a label or got a diagnosis. And like I was surprised going sort of through the last 2 years how common that conversation was. I definitely, assume that there would be a few people that would benefit from it. But yeah, like seriously, the frequency of people that have said, oh, I'm not feeling that well, but I don't know how to get help, or I'm not feeling that well, but I'm worried that if I do go and get help, it will adversely affect my career, or that sort of thing. And so I guess the purpose of today's sort of recording is to show that, um, yeah, I'm both someone that's, on track to graduating med school and hopefully becoming a doctor, and someone that's going through that process and relatively ambitious and want to have a good career. And I'm also someone that has been quite mentally unwell for a number of years. And I'm fortunate in that right now I'm not, and hopefully um, that period's behind me because it's a few years ago now. But that's also part of my journey, and the reality is that that's something that or that's a condition that I live with, and may continue to rear its head throughout the next few years or decades. Um, and so, yeah, here's my story. I guess I didn't take a usual route into med. I wanted to be a lawyer when I graduated school, and so I started in law and commerce. Um, I finished the finance degree and also took up economics, but ironically hated studying law. So graduated in finance and economics, and then started working in politics of all things, and sort of data and analysis of policy. But through that, I was also pretty unwell. I had really bad depression, and I hated getting out of bed each morning. I couldn't do it by the end. And in 2021, March of 2021, I attempted suicide, and clearly not successfully, in that I, am still here recording this video. But that was the rock bottom point for me. It was, yeah, a time that was really hard at work. It was a time, sort of, from memory, it was like 2 weeks before the gum sat. It was, um, yeah, just a rough time. But the next 12 months were also, the next 12 months were really hard, but were also um, life changing, in that before that sort of event and that hospitalization and that rock bottom, I didn't really know how to get well. I didn't really know what my mental illness was. I knew that I didn't feel right. I knew that I was probably depressed, but I didn't really know what that meant or what you're meant to do about it. And so I was, yeah, discharged from hospital eventually, and I ended up, seeing a really good psychiatrist, and have been really lucky from that front. But went on to have ECT, or electroconvulsive therapy, which is the sort of thing where you, get put to sleep, and then an electric currents pass through your brain, and you have a seizure, and you go through a few courses of that. I think I had 8. Um, and then yeah, I was really lucky in that cured my depression, and since then I've been pretty good. I still, have the occasional check-in appointment, and follow up and whatnot, but it's now been over 4, or coming up to 4 years, without a whole lot not going well. I, still do have the occasional rough day, like everyone, and I'm still sort of acutely aware that I'm, when I get depressed, I get quite depressed, and that's something that I always need to be on top of. But um, the thing is that if I didn't, in 2021, well, I mean, I guess in 20, yeah, I didn't engage with treatment really before that hospitalization, and that was where I ended up. I ended up in a really bad place in a big scary hospital, and sort of caused a lot of grief for myself, and probably a pretty rough time for the people around me as well, in hindsight. But I'm also really fortunate and really lucky in that day and that period in hospital was a turning point where, since then I've been engaged in the system in a really big way. I've sort of engaged in psychology. I've engaged in medication. I've engaged in ECT and all of those treatments that are available, and gone through those processes and gotten a lot better. And so I guess what's the point of sharing that? What's the point of saying that story? And the point is this: I wouldn't be halfway through my medical degree. I wouldn't be on track to being a doctor, and I wouldn't ever be someone that would be, tasked with the privilege of caring for their future patients and all of the good things that come with, graduating from medicine, if I hadn't sort of sought that care. I was sick, I had an illness, and I needed treatment in order to get better. In the same way that, if I fell downstairs, I'd need a cast on my leg before I could put weight on it again. And I think my point of sharing this is that it may well be that getting treatment is what you need to do to be the best doctor you can be, or to sort of succeed in all the goals and ultimately end up being in the spot that you want to be. So I guess all I'm really saying, or to summarize and hopefully not ramble, is that I'm on a really good track, and I sort of love what I do, and I've loved the last few years in medical school. I've been able to, get involved in a lot of student activities and sort of passion projects in the psych space, especially around transcranial magnetic stimulation and some traumatic brain injury research and stuff like that. But the takeaway I sort of want to convey is that the last few years have only been able to be so awesome and so good, and be where I want to be because I was able to get the care that I needed to get better, and to treat my mental health. And if I hadn't done that, realistically, I wouldn't be where I am today. I wouldn't have passed the GAMSAT on my second sit. I wouldn't have been able to get through the interview. I wouldn't have had the experiences that I had in order to reference in the interview. And then, I wouldn't have the perspective and the I guess the experiences that will realistically probably go on to help patients in the future. The thing about my story is that it's a pretty extreme example because most people won't be needing ECT and won't be in hospital, but that doesn't mean that sort of those lower acuity or lower severity mental illnesses aren't still an immense burden to carry. And that's really the target audience of what I'm saying, is that if someone's acutely unwell, they're going to end up getting care because they're going to be taken to hospital, and that process is going to happen for them, and that's really where I ended up. But for a lot of people who are moderately or mildly depressed or mildly anxious or having panic attacks in the bathroom, but then able to get back into their placement, that there's probably never going to be an ambulance and never going to be that defining turning point that forces you to get care. But that's still an incredibly brutal sort of disease to live with and an illness to carry. And so what I'm really saying is that it can get better, and it can be fixed, and then you can really, once you are well and once you are optimal, you really can go and do the things that you want to do, um, and live the life that you want to live. Um, and so I guess all I'm really saying is, if you need help, then reach out and reach out to someone, and start to move towards getting help. And that for you might be, just needing to debrief once a week with a friend about what you're seeing at placement, or what you're going through when you're studying the GAMSAT, or it might be that you do need medication, or you do need a psychologist. Who knows? I'm not a doctor, but um, what I am encouraging is starting that step and having that first conversation. For a lot of people, they don't necessarily know what that first step should be, and that's one of the things that people ask sometimes is, I know I'm a little bit depressed. What do you do when you're a little bit depressed? What's actually the right step to get treatment? And overwhelmingly, I think the answer is that find a good GP, or find a GP, and book in an appointment. And then the last thing I just really, sort of the pet peeve that I want to address, is this kind of myth that if you're in medicine or in medical school and you have any sort of condition, but specifically a mental illness, that's mandatorily reportable to AHPRA. And it's really important to understand that AHPRA are there to protect the public, and manage medical registration, but they're not there to punish people for having a life and having a condition and being unwell. If you read the sort of rules and guidelines around what AHPRA do, that the time that they intervene is when there's a clinician with an unmanaged condition that poses a genuine risk to patients in the population. And so what that means is, if potentially you had sort of a psychotic illness and you weren't getting treatment, or you'd been prescribed medication and you were choosing not to take it, and then you were still going to work each morning and seeing patients whilst hearing voices that you should do something bad to those patients, that might be a case that's probably fair enough that needs to be reported. But overwhelmingly, like the threshold for reporting, and the threshold for action is so incredibly high, and the only real risk for people is that if you need treatment and you don't engage in it, that's the only thing that is really going to hurt your sort of career, and so avoiding treatment isn't how to get through that. Find a good doctor. Overwhelmingly, every sort of clinician I've spoken to, doctors love helping doctors, and doctors love helping medical students. And have a chat with your GP, tell them honestly what you're feeling, and the rest will go from there, and see what your options are. So this is a weird video, really, and yeah, hopefully putting my story on the internet helps reduce the idea that as a medical student, you can't have a mental illness because of the stigma. I think the fact that this is now uploaded in with my name attached to it, is hopefully proof that I at least believe that. Yeah, and I really do. I expect that for the majority of people, this is maybe just a ramble, and maybe only 45 people watch it, but there is, from my sort of experience, there is a few people that could benefit from hearing something like this, and so that's why I've recorded it.